I'm Dr. Gaddi, and I'm one of the general physicians here, and my area of interest is diabetes and endocrinology. And I run my diabetes clinic once a week here at the hospital. Besides my clinical work, I also teach at the university at the Table and Clinical School as a senior lecturer. Oh, the best part, as I said, first thing was the work and life balance. That was the main thing. Well, that's what we were looking for before moving to Armidale. And 4 beautiful weathers. So the autumn and spring are the best as well. So great environment for the kids to grow up in. Lots of activities, sporting activities, and schools are really good as well. Every school in Armidale has got a great reputation. And so we love everything basically about Armidale. Yes, so definitely Armidale City is different to any other rural city because we do have a university, so we've got a very vibrant and social community here. So we have an opportunity to teach at the university. So it's great to have a Table and Clinical School here attached to a regional hospital like Armidale. You've got opportunities, of course, there's a lot of entertaining activities as well for you. There are lots of eateries, restaurants are great as well. Personally, I was never in the rural environment before. Okay, so I had some concerns about how the patients who need to be transferred out from here and how the unstable patients can be taken care of. That was my main concern moving in from a tertiary hospital, from Royal Adelaide Hospital to Armidale. So it's the other end of the spectrum I have moved into. But surprisingly, the amount of support you get in getting the patient out who's unstable is amazing. I never really felt unsafe looking after these unstable patients who never wanted to go. Well supported from the ICUs in the network as well, giving us advice where required. So that was really good. That was my main worry when I came in, is how I'm going to deal in a rural environment for a sick patient who need to go. But there is definitely well-planned process involved here. So and I felt that I was supported well in doing that. Yeah. When I started, obviously we were quite limited with the senior medical officers, but in the last 2 years we made good progress by appointing some really good senior medical officers in the Armidale Hospital. So we've got a variety of subspecialty cover at the moment. So personally myself, I look after the diabetes, so I have started the diabetes clinic in the hospital, up and running for the last 12 months now, and it's going really well. And we've got a nephrologist appointed, Dr. Chalmers, and then she's obviously supporting the patients with the renal diseases and dialysis unit over here, and also in Inverell. So that's a really good plus point for the Armidale Hospital, having a nephrologist. And we also got a geriatrician, Dr. Nanda, who was previously in advanced training here and who has taken up the position as VMO and supporting the community in offering the geriatric services as well as endocrinology. And we've got cardiology as well here by Dr. Najumian, and variety again. Dr. Braslins is covering the infectious disease side of things. We've got Dr. Gary Baker. So it's a great team at the moment. So with a lot of subspecialty cover. So that's what we have in this senior medical officer team. And obviously the person who is coming in can expect a wide variety of support from the other specialties as well. Once they come in, they'll be well supported with their area of specialty. It's a well-located place. Even though it's considered as a rural town, it's a city, located close to Sydney and also to Brisbane as well. It's well located, no harsh extremes in temperature, good activities to plan for. You can go bushwalking, beautiful waterfalls close by. So there's a lot to do in Armidale.